Alvin Jaslin was just 25 years old. He started feeling off last fall, but a stroke was the last thing on his mind. As the day progressed, however, so did his symptoms.
The night before the stroke, I felt a little bit of neck pain, and leading up after the neck pain, my vision was actually the biggest sign that something was off.
Then doctors at Cleveland Clinic made a discovery.
There's a fairly large blood clot in his brainstem, and it's traveling up the brain. And
Telltale sign that you may possibly be having a stroke is definitely changes in vision, blurred vision, and you definitely want to get checked out ASAP.
this is very time sensitive, so the sooner we get this clot out, the sooner we can prevent any permanent damage.
So the perception is that the only people who have strokes are older people, 60, 70, 80, 90. However, about 18% of strokes happen in young people, and this percentage is rising.
Cleveland Clinic's Dr. Michael Abzoop says the problem is when a young person is having a stroke, they think it's something else. Stroke is the 5th leading cause of death in the United States and contributes to the most long-term disabilities.
But the most common cause of strokes in young people is actually an injury to an artery, a dissection.
When it comes to the symptoms of strokes, remember the acronym FAST. Changes to your face. An arm goes weak, slurred speech, and T for time to call 911.
That I didn't get help in 20 hours and I'm okay is quite the miracle.
I think a very important point that the doctor touched on is a lot of young people, when they're showing signs and symptoms of potentially having a stroke, they believe it's something else. But even if you're, like I said, you're not a healthcare professional or in the medical field at all, always trust your body. You know when something's off. And again, do not hesitate to go get help. Go, call 911. Go to the emergency room. It may be a pain in the ass. Don't try to sleep it off because you never know how serious it could be.
Yeah, noting national research, Vanessa, proving racial bias in medical treatment. Mom questions whether or not race played a factor in the nurses here at Henderson School not believing them, telling the nurses her son was having a stroke. After 3 strokes, Alicia Hicks would rely on her able-bodied son to get her around. Now the 17-year-old also has trouble walking for the time being after suffering his first stroke last week. When Hicks got a call from the Henderson Inclusion School nurse, she tried explaining what was happening.
There's a small vessel problem in our brain on my mother's side of the family that causes us to stroke easily if there's any blockage. It is so important that you get him to the hospital right away because he could die.
But Hicks says the school nurse didn't think it was a stroke and wanted her to come pick him up. Problem was, Hicks was home alone, sick, and not mobile.
Your professional eye may not see the stroke. It's not visible. But if he's telling you he's weak on the left side, please. And at this point, I'm urging her with all intensity that I could muster up with no voice. Please get my son to the hospital. Please, please, please.
They start arguing with her on that while I'm out here stroking out on the bed right now, trying to stay up, because I was afraid that if I fell asleep or something like that, I was either going to go into a coma or probably for the worst.
The family says they went back and forth for 45 minutes with no 911 call. Instead, a call to the Department of Children and Families.
And then you could hear the other one in the background, the other nurse. Oh, call DCF.
After the DCF call, the nurse called 911. At the hospital, doctors were able to stop the stroke with medication. After staying 2 days, he's back home now, but hasn't been back to school.
He's not happy about the school right now. He doesn't feel safe there. In his words, when he was in the hospital, he said, I can't believe they didn't believe me.
And the school sent this note to the Henderson families that day saying paramedics were called to support a student having a diabetic episode. When we reached out for more information, the school told us medical privacy prevented it from saying more. DCF actually told us the same thing. DCF also adding that it is investigating the report.
Wow, this is actually absolutely absurd when you really think about it, that these nurses dropped the ball like this. Given the fact, just off the genetic history alone, and the fact that he's telling you he has left-sided weakness, I mean, even if you want a nurse, let's just use common sense here. Common sense will tell you, hey, his mom has some type of genetic disorder and she's had 3 strokes. He's saying he's having left-sided weakness and needs to go to the hospital. Why not send him out and err on the side of caution? I mean, that's just common sense. So the fact that these nurses were sitting on the phone and arguing with this woman for 45 minutes going back and forth. And then they even called Child Protective Services before calling 911. It definitely may be some racist bias there. If that was my child, definitely would have a lawsuit ongoing, and my child would not be returning back to that school at all. I mean, this young man could have literally lost his life or had some type of permanent disability. Because the one thing about stroke is it's so hard to fully recover and get back to yourself prior to you having the stroke. I mean, I just can't believe that they would sit there on the phone. And I honestly, the mother, I'm surprised that she would go back and forth on the phone with these nurses for 45 minutes. I mean, after about 2 minutes, and I explained everything that was going on with my son and the history, I would have hung up the phone and called 911 myself and had him sent straight to the school. I mean, this really could have went left. Luckily, he ultimately did get to the hospital, and they were able to medicate him and prevent him from having a stroke. But I mean, this really could have went totally left.
But coming back today made me realize a case I had back in the day that I never really shared, but I thought I'd share today because I remembered it, and I feel like it's useful information in it. So essentially so it's to do with strokes, just to get out there. So it's to do with a very young patient. And obviously, if I ask anybody how to identify a stroke, they're going to say FAST, fast, whatever, face, arms, speech, and then time to act. And whilst this is very good because it will help you identify a lot of cases, it doesn't allow for different types of presentations. So I had a young patient, been on holiday, all of a sudden had a headache, and did not have any of the fast symptoms, but patient was finding it difficult, I wouldn't say difficult, but was taking longer to speak. So imagine you're saying, I went to the park today. For her, it became, I went to the park today. So there's that little space between where usually before she can say it very easily, but now there's a bit of a delay. Now she came to ED after a couple of days, I think, and they were sleeping it off for a couple of days because they thought it was a migraine. So when they've come to me, they said, Doc, I've just come for a migraine. Can I get some medication, some strong painkillers so the headache can go? So then I've obviously said, give me the history, exactly what's happened. I'm looking at the patient and I'm thinking, there's no way this is a migraine. Factually, this ain't no migraine. So I've gone to my consultant at the time and I said, look, I've not even taken a full history, but can we get an urgent CT? I think she's got a bleed on her brain, and I think we're looking at a stroke. So obviously my consultants, they're fantastic. So got the CT signed, and that was all getting done once I was taking the rest of the history. So I kept saying, let me just get my medication and I can stop wasting your time. And I'm thinking, look, you're not wasting my time, one, and two, like, we're looking at a more serious diagnosis here. But obviously I'm not trying to scare the patient, so I'm going to wait for everything to come back. But I did let the patient know that, look, I think this is a bit more serious and I think we're going to scan your head to make sure we're not missing anything. Honestly, it'd probably take me 5-6 minutes to explain this properly, but long story short, scan came back, she had a massive bleed on her brain. And obviously there's two types of strokes, like I said, so there's ischemic and there's hemorrhagic. Ischemic is when there's obviously a blockage of the blood supply to a part of the brain, tissue dies. And obviously if your brain controls, for example, if your brain controls how you speak, if that part of the brain dies, then the way you speak is going to change. If the brain controls how you move your hands, if that part of the brain dies, then you may not be able to move your hands. So that's why you get the whole fast symptoms for people to understand if you're not doctors. But essentially, if you get a bleed on the brain, then that ruptures the blood vessel and that can bleed into the brain tissue as well, and it can cause very similar symptoms. But depending on where it is and how it's happened, it may not present as a typical stroke. So she's very young as well, 30s. So like, it's not just the elderly people that get strokes. You can be very young and get a stroke, but it's just to raise awareness that if you are having sudden difficulty with how you think, being able to comprehend things, being able to get your words out, think a stroke as well. So it's not just FAST, it's not just fast. There are so many different signs and symptoms of strokes that I can get into, but I won't because I'm tired and I'm going home. But yeah, I guess that's just an interesting case that was on my mind. I never shared and I'm sharing today. So that's enough for me anyway.
Shout out to this doctor for a very thorough assessment and literally saving this patient's life. Picking up on such the small pattern in her speech that seemed a little bit off, getting the CT scan, and where they ultimately found a bleed. Again, this is excellent care. Again, shout out to this doctor. Because we see so many times, especially in hospitals, especially in ER, it's very busy. Something like this could have been missed, could have been overlooked. Um, Simply giving some ibuprofen, sent home, and then next thing you know, 2, 3 days later, the person could have stroked out.
So the way I had a stroke, well, the thing is because I fell a couple weeks prior, but I went to the hospital for headaches, and they didn't see nothing. And then a couple days later, I had the symptom. I was confused, and I was saying stuff I don't mean. So
As you can see, that's why I played the clip before with the doctor giving you the signs and symptoms. She had a fall. She was complaining of migraines. She went to the hospital. Not sure what happened. I'm not sure if they did any scans or they just kind of brushed it off as a migraine, gave her some medicine. She went home. Now the symptoms started to progress. She was having difficulty speaking. Sounds like her balance, her equilibrium was off. Let's continue.
I was on the phone, and I was talking to my sisters, and I was saying the wrong words and stuff.
Hmm. So I mean, it's ultimately looks like she did have a stroke. As you can see, she might still be in the recovery phase. You can tell that her speech is a little delayed. Again, this is a very, very serious matter. Just because you're a young person does not mean you cannot have a stroke. Again, what's most important when something is off with your body, call 911. Always err on the side of caution.
6 years ago, I had a stroke. Here's what no one told me to do. Listen, you have so much time where we can sit and be depressed. But if you realize that, hey, I can get it. Now, it may take you 1 year, it may take you forever, but you're still going to work it hard. You have the ability to set up your mind to say, okay, this is what I'm going to do. Let's start it now.
She is absolutely right. Again, you can see she had a stroke here. She's still recovering, trying to get her, speech pattern back. Again, the most difficult thing involving a stroke is post-stroke. The recovery process is ongoing, and again, it could take maybe a few months, or it can take a lifetime. It's so that's why it's very important to try to prevent, making sure we're eating right, eating healthy, being mindful of what we're putting into our bodies. Also a big factor into this thing is stress, especially with the economy and people being unable to afford rent and groceries. That all factors into this, your alcohol consumption. There's a lot of factors that go into this, but the key is to being aware and recognizing the signs and symptoms. The slurred speech, a facial droop, uh, you know, being off balance, blurred vision, and again, just trusting yourself and knowing your body. If you feel like something is off, just go to the 911. I know it may be inconvenient. It may, you may not even have the funds, but at the end of the day, if you don't have your health, you don't have anything. But let me know in the comments below. I look forward to hearing from you what you think regarding this topic of young people stroking out at such a young age. Don't forget to like, subscribe, and share.